Welcome to Daily Dose of Parenting, your one-stop solution for all your parenting concerns. We're here to navigate the often overwhelming journey of parenthood, providing you with expert advice and practical tips to make your life a bit easier. From sleepless nights to first smiles, we cover all aspects of parenting, offering insights that are both informative and comforting. Whether you're a first-time parent or a seasoned pro, our channel aims to support you every step of the way. We encourage you to join our community by subscribing to our channel. That way, you won't miss out on our regular updates designed to help you become the best parent you can be. Today, we're going to tackle a topic that many new parents grapple with. In this episode, we will discuss the 10 most common mistakes parents of newborns make. So, let's dive in to ensure you're well equipped on this wonderful journey of parenthood. The first mistake is a common one: letting the newborn sleep on his or her tummy. While it may seem like a comfortable position, it actually poses a significant risk to your little one's safety. Why is this dangerous, you might ask? The primary concern here is the risk of sudden infant death syndrome, or SIDS. This is a tragic event where a seemingly healthy baby dies unexpectedly during sleep. The exact cause of SIDS is unknown, but it's believed that a combination of physical and environmental factors play a role. One of these factors is the baby's sleep position. When a baby sleeps on their stomach, they might breathe in carbon dioxide instead of fresh air. If this happens, the baby's oxygen level can drop and carbon dioxide can build up in their body. This can lead to difficulty breathing and even suffocation, especially if the baby's face is against a surface like a mattress or a pillow. So, what's the correct sleeping position for newborns? The American Academy of Pediatrics recommends that healthy infants be placed on their backs for sleep, as this is the safest position to reduce the risk of SIDS. This recommendation applies to both nighttime sleep and daytime naps. Some parents worry that babies sleeping on their backs might choke if they spit up during sleep. But don't worry, babies' airway anatomy and gag reflex will keep them safe. Even if your baby spits up while on their back, they are less likely to choke than if they were sleeping on their stomach or side. It's also important to keep the sleep area clear of any objects such as blankets, pillows, or stuffed animals. These items can increase the risk of suffocation and should be kept out of the baby's sleep area. And remember, while it's crucial for your baby to sleep on their back, supervised tummy time when your baby is awake can be very beneficial. It helps strengthen your baby's neck, shoulder muscles, and motor skills. Always remember, back is best when it comes to your newborn's sleep position. Ensuring your baby sleeps safely is one of the most important things you can do to protect their health and well-being. The second mistake is allowing just anybody to kiss your newborn. Now, we know it's hard to resist those chubby cheeks, but it's crucial to understand that this seemingly innocent gesture could potentially put your baby's health at risk. Why, you ask? Well, newborns have underdeveloped immune systems. That means they're not ready to fight off infections or diseases just yet. So, when someone plants a kiss on your baby, they could unknowingly pass on harmful germs that can lead to various illnesses. One of the most serious concerns is the transmission of herpes simplex virus, a common virus that can have severe consequences for infants. Now, this doesn't mean you need to put your newborn in a bubble. It's all about balance and taking precautions where necessary. So how can you navigate this tricky territory without offending well-meaning friends and relatives? Firstly, it's okay to set boundaries. Kindly explain to visitors that while you appreciate their love and affection towards your baby, it's best if they refrain from kissing them. You can suggest alternative ways they can bond with the baby. A gentle touch, a soft whisper, or just a loving gaze can express their affection without compromising the baby's health. Secondly, make sure everyone who comes into contact with your baby has clean hands. Washing hands thoroughly is a simple yet effective way to keep harmful germs at bay. And finally, keep your baby's vaccinations up to date. Vaccines provide a layer of protection against some diseases and can help strengthen your baby's immune system. So while it's wonderful to see your friends and family adore your newborn, remember that your baby's health comes first. It might be a bit uncomfortable to enforce these rules, but your loved ones will understand that you're just doing what's best for your little one. Remember, protecting your newborn's health is more important than meeting societal expectations. Another common mistake is leaving dirty diapers on for too long. It's easy to understand why this might happen. Life with a newborn can be hectic and time-consuming, and sometimes it's tempting to let a little pee or poo slide for a bit longer than we should. However, this seemingly harmless delay can lead to some unpleasant consequences. First and foremost, leaving a dirty diaper on for a prolonged period is unsanitary. Newborns urinate and excrete more frequently than older babies, and their delicate skin is in direct contact with this waste. This moisture, coupled with the warmth of the diaper, creates a perfect breeding ground for bacteria. The most common risk associated with leaving a dirty diaper on is diaper rash. This uncomfortable condition is characterized by red, inflamed skin that can cause considerable discomfort for your baby. It's not just the presence of urine or feces that can cause a rash either. The friction from a diaper, especially if it's been on for a while and is saturated, can also irritate your baby's skin. But it's not just about rashes. Prolonged contact with urine and feces can also lead to yeast infections and urinary tract infections, especially in baby girls. These conditions are not only painful for your baby, but they can also require medical treatment. So how often should you change your baby's diaper? The answer to this can vary, but a good rule of thumb is to change your baby's diaper every 2 to 3 hours during the day. At night, you can let your baby sleep for longer periods without a change, unless they poop or you notice the diaper is heavily wet. Remember, each time you change your baby's diaper, you're not just making them more comfortable, you're also taking an important step towards preventing infections and promoting good hygiene. So even when you're tired or when your baby is finally sleeping peacefully, make the effort to keep those diapers fresh. Keeping your baby clean and dry is step one of good hygiene practices. The fourth mistake is overdressing your newborn. It's a common misconception that newborns need to be bundled up in layers and layers of clothing to stay warm. However, this is far from the truth. Overdressing your little one can actually lead to overheating, which can be quite serious. Overheating can cause a newborn to become dehydrated and even develop a fever. So, how does this happen? Well, newborns are not yet able to regulate their body temperature as efficiently as adults. This means they can easily become too hot if they're wearing too many clothes. When a baby is too warm, they may become distressed, which can lead to dehydration. And if their body temperature rises too high, it can result in a fever. Now, you might be wondering, how should I dress my newborn then? Here's a simple rule of thumb. Dress your newborn in as many layers as you're wearing, plus one. For example, if you're comfortable in a t-shirt and jeans, your baby will likely be comfortable in a onesie, a light sweater, and pants. It's also important to pay attention to other factors that can influence your baby's body temperature. For instance, if it's a hot day or if the room is particularly warm, you might need to remove a layer of clothing from your baby. Don't forget to check your baby regularly for signs of overheating. These can include sweating, damp hair, flushed cheeks, heat rash, and rapid breathing. If you notice any of these signs, remove a layer of clothing or adjust the room temperature. Remember, it's always better to err on the side of caution when it comes to dressing your newborn. It's much easier to add a layer of clothing if your baby is cold than to cool them down if they're overheating. When in doubt, remember, your baby probably needs one more layer than you do to be comfortable. The fifth mistake is letting your newborn cry without attending to them. Now, we've all heard the old adage, let them cry it out. While there may be some merit to this approach with older babies, with newborns, it's a different story. Newborns cry for a reason. It's their only form of communication. They might be hungry, tired, uncomfortable, or simply in need of a cuddle. When you respond promptly to their cries, you're not just meeting their immediate needs, but you're also helping them feel safe and loved. Ignoring a crying newborn may seem like a convenient approach, especially when you're exhausted and craving a moment of silence. But this can have unintended consequences. Regularly letting a newborn cry without attending to them can increase their stress levels. This is because when a baby cries, their body releases cortisol, also known as the stress hormone. While occasional stress is a normal part of life, chronically high levels of cortisol can potentially affect a baby's brain development. Research suggests that it can impact areas of the brain responsible for emotion regulation and can even affect the child's temperament and behavior later in life. Moreover, consistently not responding to a crying baby can make them feel neglected. This can impact their sense of security and may affect their ability to form secure attachments in the future. So, what can you do? Well, try to respond to your baby's cries as promptly as you can. Learn to recognize their different cries and what they might mean. And remember, it's okay to ask for help. Parenting is a tough job, and everyone needs a break sometimes. Reach out to your partner, a family member, or a friend when you're feeling overwhelmed. Remember, your newborn is crying for a reason. It's their only way to communicate with you. The sixth mistake is giving your newborn a pacifier too early. Now, pacifiers can be a godsend for many parents, offering a quick solution to soothe a fussy baby. However, timing is crucial. Introducing a pacifier before the baby is 2 months old can lead to something called nipple confusion. What's nipple confusion, you ask? Well, it's when a baby has trouble adjusting between a bottle, breast, and pacifier. Each requires a different sucking technique. A pacifier requires less effort than breastfeeding, and so a baby might start to prefer the easy option, leading to difficulties in latching onto the breast. And proper latching is essential to ensure that the baby gets enough milk and the breastfeeding parent is comfortable. Furthermore, early introduction of a pacifier might mask feeding cues, leading to decreased milk supply in breastfeeding parents and less weight gain for the baby. So it's important to establish a good breastfeeding routine first before introducing a pacifier. Now you might be wondering, when is the right time to introduce a pacifier? Most experts agree that it's best to wait until breastfeeding is well established, usually around the 2-month mark. But remember, every child is unique, and what works for one might not work for another. So, it's always a good idea to consult with a healthcare professional if you're unsure. And when you do introduce a pacifier, remember to keep it clean. Bacteria love to hide in all the nooks and crannies, so regular cleaning is a must. Also, never dip the pacifier in sweet substances to entice the baby. This can lead to tooth decay later on. In conclusion, pacifiers are not inherently bad. Like any tool, they just need to be used properly. Patience is key when it comes to introducing a pacifier. Wait until the right time, keep it clean, and always pay attention to your baby's cues. And remember, you're doing a great job, and you're the best parent for your baby. The 7th mistake is leaving stuffed toys next to your sleeping baby. Now, it's understandable why parents do this. The idea of having a cute, fuzzy companion next to your baby might seem comforting. It's a picture-perfect image, isn't it? However, this seemingly harmless act can pose a serious risk. You see, the presence of stuffed toys in a baby's sleeping area can lead to sudden infant death syndrome, more commonly known as SIDS. How so? Well, newborns lack the strength and motor skills to adjust their position if they happen to roll over and bury their face in a fluffy toy. This can lead to suffocation, a primary cause of SIDS. So what should you do? The answer is simple and straightforward. Keep the baby's sleeping area free of toys. Yes, you heard that right. No teddy bears, no cute bunny rabbits, no dolls, nothing. The only items that should be in a crib are a firm mattress covered by a fitted sheet. That's it. This might seem stark and a little uncomfortable, especially if you've spent time lovingly choosing toys for your little one, but safety should always come first. And remember, there's plenty of time for your baby to play with their toys when they're awake, and you're present to supervise. Also, don't forget about blankets, pillows, and bumpers. These too can pose a risk of suffocation and should be avoided in a baby's sleep environment for at least the first year. Instead, opt for wearable blankets or sleep sacks to keep your baby warm. So, as we wrap up this segment, keep this mantra in mind. A clear crib is a safe crib. This is not just a catchy phrase, but a vital guideline to ensure the safety of your little one. Let's prioritize their well-being and make sure they have a safe, comfortable sleep, free from any potential hazards. The 8th mistake is co-sleeping with your newborn. Many parents find the idea of co-sleeping appealing. It's a tender image, isn't it? Nestling close to your little one, drifting off to the rhythm of their gentle breath. However, this seemingly harmless practice carries significant risks. The most glaring danger is the possibility of a parent accidentally rolling over onto the baby. Newborns lack the strength and motor skills to move out of a compromising position, making them vulnerable to accidental suffocation or strangulation. A parent, exhausted from the day, may not even realize they've shifted in their sleep. It's a horrifying thought, but it's a risk that's all too real. Another concern is the baby's sleeping surface. Adult beds aren't designed with infant safety in mind. They often have soft mattresses, fluffy pillows, and loose bedding, all potential asphyxiation hazards for your little one. Even a small gap between the mattress and the bed frame can pose a risk, as your baby could slip into it and get trapped. So how can you ensure your newborn is safe while sleeping? The safest place for your baby to sleep during the first 6 months is in a separate cot or Moses basket in the same room as you. This arrangement allows you to keep a close eye on your baby while minimizing the risks associated with co-sleeping. But what about those nighttime feedings or when your baby needs comfort? Skin-to-skin contact is important, and there are safe ways to provide it. You can bring your baby into your bed for nursing or comforting, but return them to their own safe sleeping area when you're ready to go back to sleep. Remember, your role as a parent is to create a safe environment for your child to grow and thrive. It's completely natural to want to be close to your newborn at all times, but it's crucial to balance this desire with their safety needs. Safe sleep is crucial for your newborn's health. The ninth mistake is not cleaning your newborn's gums. You might think, but my baby doesn't have teeth yet, so why bother? Well, it's important to understand that good oral hygiene starts from birth, not when the first tooth appears. Just like adults, babies' mouths are full of bacteria. While not all of it is harmful, some can lead to oral diseases in the future. When a baby feeds, whether it's from a breast or a bottle, a residue of milk lingers in their mouth. This milk can mix with the bacteria, creating an environment conducive for the growth of harmful bacteria. So, cleaning the newborn's gums after each feeding helps remove these germs and bacteria. Think of it as a preemptive strike against future dental issues. Now you might be wondering, how do I clean my baby's gums? It's quite simple, really. Start by washing your hands thoroughly. You don't want to introduce any additional bacteria into your baby's mouth. Then wrap a clean, damp washcloth or gauze around your finger. Gently open your baby's mouth and wipe their gums. Remember, you're not scrubbing a stain out of a carpet here. Be as gentle as possible. The goal is to wipe away any leftover milk and bacteria. Do this after every feeding, and you'll establish an oral hygiene routine that will benefit your baby for life. This simple practice is an investment in your baby's future oral health. It can help prevent the development of tooth decay when those adorable little pearly whites eventually start to come in. Plus, it's never too early to establish good hygiene habits. So, the next time you're feeding your little one, remember to take a couple of extra minutes to clean their gums. They might not appreciate it now, but they'll thank you later when they have a healthy, sparkling smile. And that's the ninth mistake, not cleaning your newborn's gums. It's an easy one to avoid, and one that can have significant benefits for your child's future health. Good oral hygiene starts from birth. The 10th mistake is leaving your baby alone with a pet. Pets are wonderful, and they often become an integral part of our families. They teach us about love, responsibility, and can bring immeasurable joy. But when it comes to newborns, it's important to exercise caution. Even the most gentle and loving pets can become unpredictable around a new baby. This is because they might not understand what this tiny, fragile creature is and why it's getting so much attention. Their curiosity, or perhaps their jealousy, might lead them to behave in ways that can be harmful to the baby. Remember, pets, like dogs or cats, have instincts that can suddenly kick in. A playful swipe from a cat or an overly enthusiastic nudge from a dog could result in unintentional injuries. And it's not just about physical harm. Some pets may harbor germs that are harmless to adults, but could lead to infections in babies with their still developing immune systems. So how do we navigate this? The answer is simple. Never leave your newborn alone with a pet, no matter how well behaved or familiar. Always supervise interactions between your newborn and pets. Introduce your pet to the new baby gradually and under controlled conditions. Let them sniff a blanket or a piece of clothing the baby has worn. This will help them get used to the baby's scent. Reward them for calm behavior around the baby. If you have a dog, remember to keep up with their walks and playtime. This will ensure they don't feel neglected or become restless. For cats, ensure they have their own space where they can retreat if they feel overwhelmed. In time, your pet and your baby can develop a beautiful bond. But until your child is old enough to understand how to interact safely with pets, your vigilance is the key to ensuring the safety and health of both your newborn and your pet. Always supervise interactions between your newborn and pets. Let's wind up our video with a recap of the 10 most common mistakes parents of newborns make. We're highlighting everything from the perils of unsafe sleeping positions to the significance of hygiene practices such as cleaning your baby's gums and changing dirty diapers promptly. We're also drawing attention to the risks involved in introducing certain habits like a pacifier too soon. We're making sure to end on a positive note, reminding all parents that it's normal to make mistakes and that to learn and grow from them. Here's to happy parenting. Don't forget to subscribe to our channel, Daily Dose of Parenting. To make sure you don't miss out on any more helpful tips, simply hit that subscribe button and continue learning how to be the best parent you can be.